I just want to thank you all for joining us this evening. I see more and more folks are joining this session, this webinar, and we're just so pleased to have you here tonight. I just want to start by giving a brief overview of who Sacramento Steps Forward is and what we do as an organization. So we're a local 501c3 nonprofit when we partner with local, state, and federal agencies to accomplish our shared goal of ending homelessness. And Sacramento Steps Forward is the lead agency of the Continuum of Care, which is the regional planning body that coordinates housing and services for homeless families and individuals in Sacramento. And as a part of that leading role, not only do we receive and manage funds for housing programs and coordinating services for people experiencing homelessness, we also do things like the point in time count, which you all graciously were a part of and we'll hear more about today. And that's really where I think I want to put the most emphasis that I can, is just to thank all of you who attended the point in time count, because this year we had the greatest number of volunteers we've had, with 800 plus volunteers taking an active role in our collective vision for an equitable community where everyone has a safe place to call home. And we quite literally could not have done the point in time count without you. And we do hope that you'll continue to share your time and your talents with us in future point in time counts and beyond. I will, in a moment here, introduce Dr. Simmons, who's going to give us a detailed view of what the point in time count looks like. But just as a high level overview of what we're going to be talking about today, the PIT count reveals a decline in homelessness with greater numbers of people being sheltered. We know that this is due to greater capacity, more favorable market forces that likely contributed to that decline. And we've also seen an increase in collaboration and investments across the regional homeless response system, which we know to be making a difference. We also know that more is needed to sustain results. And as many before me have said, this is truly a marathon, not a sprint. So to get down into the detail, I'd like to now welcome Dr. Trent Simmons, who was an integral part of not only conducting the point in time count, but developing the report. So Trent, take it away.
Thanks, Rachel. Like Rachel mentioned, my name is Trent. I'm happy to go through some of the information that we have on our website about the report and also about the PIT count generally. For those of you who haven't seen it, I'm going to share my screen really quickly. Assuming everybody can see my screen now. Cool. This presentation is actually on the Sacramento Steps Forward website. And so if you navigate over to the 2024 report, you will see this entire presentation. So if you ever want to be reminded or to go into a lot more detail, you always have that opportunity. Of course, there's also an infographic that kind of helps condense some of this information into a couple of pages. We also have a lengthier report that's a bit longer. I say a bit, but it's about 50 to 60 pages. So there's a lot more information. But there's a lot of different ways to help ingest and explore this information. So to start, again, all of you help contribute to the count, but maybe providing some extra context around the count would be helpful for make sure everybody's on the same page. One thing I really want to emphasize with this effort is that it is a point-in-time snapshot, and it is used by HUD to estimate homelessness in our community and help better understand those who are experiencing homelessness. Like I mentioned before, HUD, the U.S. Department of Housing and Urban Development, mandates this effort in all communities across the country. And it is implemented by the board, Continuum of Care, which is a group of agencies who are responsible for directing homelessness resources and funding to providers in the area. This information is collected across all of the communities. It's collected together into an annual homeless assessment report that is delivered to Congress. And it is useful for informing policymaking funding, provides insight into our community services and support. And in most communities, it takes place biannually. And that's really the unsheltered component, which is really the component that all of you had an opportunity to participate in. But in some communities, it takes place every year. Moving on a bit further, in Sacramento, the PIT count is managed by the Sacramento City and County Continuum of Care, and Sacramento Steps Forward. As you know, because you were part of the count, we recruited more than 900 volunteers who were able to show up on that night and to actually across multiple nights, I should say, and contribute to the counting efforts that were absolutely critical for the report. And we collaborated with outreach staff to help augment survey efforts on other nights, including counting the American River Parkway and also targeted efforts in certain areas. And that survey was done throughout Sacramento County. Jump right into the results. Like Rachel mentioned, we did see, compared to 2022, a 29% decrease in homelessness overall. And if you take that entire 29% and you break it out by sheltered versus unsheltered homelessness, you see a 41% decrease in unsheltered homelessness and a 2% increase in sheltered homelessness. Off to the right, you can see that count broken out by year, really PIT count year, and also by shelter status. And you can see that even though we see an overall decrease from 2022, we are technically higher than we were in 2019. So we haven't quite gotten back to pre-pandemic levels. We're still about 19% higher than where we were in 2019. All of this to say that even though we are showing a decrease from 2022, by no means has homelessness disappeared or completely invisible within our community. There's still a lot more work to do. Going into more of the findings specifically, for all of those that we found and for all of those that were part of the count, we have the demographics of those that we had encountered. And here you can see that about 17% of those that were part of the PIT count were families with children, about 8% were veterans, and about 45% were chronically homeless, which means that they'd been experiencing homelessness for at least a year, also having a disability. Just a few other demographics here to help you get to know more the faces behind the numbers. Off to the right, you can see the age distribution, where roughly 10% or so were under the age of 18, and about 20% were 55 and older. Off to the bottom, you can see just a few snippets for race and ethnicity, with Black and African American individuals being roughly 3 to 4 times more likely to be homeless, and American Indian or Alaska Native individuals being about 5 to 6 times more likely to be homeless within our community. And all of that is compared to census data. So if you're curious to know where that number comes from, it's a comparison relative to the residential data in the neighborhood. We can look at demographics. We can also look at the intersection of demographics with whether or not somebody's sheltered. And you can see that for some of the demographic groups here. Off to the left is household composition. This is the 3 core demographic groups or household types that HUD collects during the count. That includes households with no children, adults with children, and unaccompanied minors. And you can see that for the top group, adults with no children, which is about 5,500 individuals of the count, about 29% of that group was sheltered, and about 71% of that group was unsheltered. For adults with children, about 97% of that group was sheltered, and for unaccompanied minors, that was about 48%. Now, I do want to call everybody's attention to the absolute counts underneath those percentages, because the size of those 3 different household types is very different. So for adults with no children, that's about 5,500 individuals. But for unaccompanied minors, that's about 25 people who were tracked during the count. Off to the right, we have that same breakdown, but for a few different demographic groups, chronically homeless, veterans, and adults with serious mental illness. For chronically homeless, about 32% of that group was sheltered during the count. For veterans, 40% were sheltered. And for adults with a serious mental illness, about 17% were sheltered. We can also break the count down by sub-jurisdiction or geography. You can see that about 77% of the unsheltered count were within the boundary of the city of Sacramento, with about 14% in unincorporated county area And then the remaining areas, Folsom, Elk Grove, Citrus Heights, Rancho Cordova, Galt, and beyond, all collectively constituted less than 10% of the count. And this is actually somewhat similar, generally speaking, from year to year. City of Sacramento tends to be the lion's share of the count each year. Not only do we have the opportunity to understand who is present during the count, we also have the opportunity, as many of you got during the count, to sit down to have conversations and to ask them about their experiences. And the bullets in this page provide just a small snapshot into those experiences. Of those who were surveyed during the count, 90% had been Sacramento County residents for more than 6 months, with about 62% either originating from or being lifelong residents of Sacramento County. About 74%, or 3 in 4, had to move and find a new sleeping location within the last 2 months. About 68%, or 2 out of 3 people, had been experiencing homelessness for at least 2 years. About 58% believe that the number one thing that our region could do better to help them was to increase affordable housing. And about 50% were experiencing homelessness for the first time. Now, I want to just take a quick second to connect that bullet, the 50%, to the 68%. How is it possible that you can have 50% of your population experiencing homelessness for the first time, but also 68% being homeless for at least 2 years? And what that really points to is a huge portion of our unsheltered population who have been in their first episode of homelessness for years. This is truly their first time being homeless, and they have been in that first time for years, which means that a huge chunk of the people that were found during the count were actually homeless during the 2022 count and likely shared their experiences during that count too. And then finally, about 25%, or 1 in 4, had been placed in foster or group homes before turning 18. Now, there's other things that the report covers, and I highly recommend, if you have other questions or things you want to dive into beyond this list, to go back and look at the report to learn more about their experiences. So, like you, I think we had a lot of questions when we first saw that number. 29% decrease. That's huge. And I like research. I like data. And everybody here at Sacramento Steps Forward and beyond, we're really curious to see whether or not that number can pass the sniff test. So we wanted to look at other data sources, other things around the PIC count to see if it makes sense that we would experience a decline. So I want to go through just a few of those factors of this group first, so you can kind of get a sense for all of the data or all of the context kind of around that PIC count. So to start, one of the things that we found is that when we looked at particularly communities around Sacramento, Greater Bay Area, it's not really a true region, but that's kind of what I'm calling it right now, Bay Area and beyond, homelessness declined across quite a few of those communities. And in fact, unsheltered homelessness is just 2% above 2019 levels across the state. Moving back into some other factors here, collaboration and investment have been increasing across the homeless response system for years. And quite a few of these things have actually started and been implemented since the 2022 count, which I think is incredibly important to point out here. Just go through some of these things. 120 million in state funding through homelessness housing and assistance grants since 2019. There was Project Room Key and Home Key during COVID. There were formalized city-county partnership that was started in 2022. The local homelessness action plan that was implemented in 2023. The coordinated access system, which helped coordinate and streamline access to shelter and other resources, was launched in 2023. There have been more investments in shelters and affordable housing, increased behavioral health services and coordination, and expanded prevention efforts. Many of these things, like I said, being done in ways and within the last 2 years that they haven't been done in the past. With greater collaboration and greater investment, hopefully you'd have greater capacity, and that's what we find. In the most recent report that we submitted to HUD, we find that shelter and transitional housing beds have increased over the last few years. Between 2020 and 2024, shelter and transitional housing beds have increased by 84%. Rapid rehousing slots, which is a form of permanent housing, was increased by 25%. and permanent supportive housing was increased by 30%. With greater collaboration, funding, and capacity, you'd hope to have better outcomes for your system. And that's also what we find. Within the last few years, we've seen an increase of 68% in the number of people that we can serve in shelters on a yearly basis. We've seen a significant increase in the number of people that we've been able to successfully exit from street outreach programs. That has increased in the last couple of years by 30%. And we've also seen a 39% in the number of people placed in permanent housing, which is incredible. Beyond that, we can look at HMIS data, we can look at data we've submitted to HUD, we can look at data that's being collected by other communities. But going a bit deeper into Sacramento specifically, we also wanted to look at the rental market because there's a lot of research outside of Sacramento across the country that points to the rental market as being one of the strongest predictors, if not the strongest predictor of homelessness in any given geography across the country. Specifically, you can kind of parse that out into vacancy rates and rental rates. And in 2022, in the middle of the count, both of those were at some of the most difficult levels than they have been in years. Vacancy rates were exceptionally low and rental rates were exceptionally high. Since 2022, really since the peak of 2022, where it was the worst, both of those have trended in the opposite direction. Vacancy rates have increased by 58% since 2022, and rental rates have decreased by about 3% since 2022. And recognizing that these two factors tend to be some of the strongest predictors of homelessness in any area, and combining that with all of the other data that we've collected, all of these factors point to a decrease. So, in conclusion, I think it's important to remember, to Rachel's point, that this was a success. But not only was it wasn't just a one-time success. It doesn't mean that we can stop. We don't need to necessarily hang up our cape at this point. The goal is to keep going, to treat the response to homelessness and our efforts to resolve this crisis for more and more people in ways that we have never done before. Rather than treating this effort like a sprint, we treat it like a marathon. That means being committed to going all in on our regional plans. Now, we've committed to partnering with the city and the county and other jurisdictions, but seeing improvements and doing that partnership matters the most if we continue to engage at that level and we continue to see those outcomes. This is going to include continued and consistent federal, state, and local funding to kind of continue to prop up the capacity that we've built over the years. This includes integrating the services and agencies across the county in ways that we've never been able to before, to help reach people who are experiencing homelessness in ways that we've never been able to reach before. That includes partnering with hospitals, partnering with managed care plans, partnering with groups beyond the traditional homeless response system and expanding that capacity. This also means including a greater focus on strategies to prevent people from being homeless in the first place. I mean, just a few slides ago, you saw that 68% of people who were surveyed during the count mentioned that they'd been homeless for at least 2 years. I mean, for a lot of people, this crisis is long and it needs to end quicker. And so the more that we can help people and prevent people from homelessness before it starts, the better. And then finally, as indicated by about 58% of the people who were surveyed during the count, increasing affordable permanent housing is one of the things that we can do to continue to see better improvements over time. So this isn't by no means the end. This is a call to action in ways that we haven't had in the past, and to continue to see better and stronger outcomes. And with that, I'll pass it back to Rachel.
Thank you so much, Trent. We've seen a couple of questions come in through the Q&A. If you have more, please continue to filter those through.
One question, Trent, I think you may be able to speak to is an example of one larger question we've seen throughout the community related to movement of people prior to the count. This particular attendee said that they had a member in their group who was a representative from the city DCR who mentioned that a portion of the area that we were counting was cleared about a few days prior to our count. And they asked, was SSF aware of the DCR efforts and how that might have impacted the accuracy of the count? So if you could speak to that and how the movements were not changed before the count as with previous years, and how that speaks to the point in time aspect. Thank you.
Sure. Unfortunately, I can't speak to any of the efforts on behalf of DCR in that case. But as far as the accuracy of the count, it's really difficult to say exactly how that would have impacted the count. For example, when you look at 2022 in the executive summary, you'll find that roughly, if I remember correctly, 64, 66, it's somewhere in the 60s, percent of those who were surveyed during the 2022 count had mentioned that they had been relocated or needed to relocate within 2 months prior to the count. And with our data from 2024, the number is about 74%. So it's technically higher, but they're actually very similar. So with 2022, you see that roughly 2 out of 3 people were relocated, but we see a 67% increase in those who are experiencing homelessness in our community. But in 2024, we see a slight uptick in that percentage based on those we were able to find through the survey. And we see a 29% decrease overall. So it's really hard to know exactly how that would have impacted the count. In some cases, the individuals who had moved would have been in areas that were part of the count, just in other ways. So that might have impacted the count in that one particular geography, but not necessarily in others. That's one of the things that I think is really important to keep in context with the count in general, is that things that happen in one particular neighborhood or one particular block may not necessarily impact the count across the entire county.
Thank you, Trent. There was one question that we had answered regarding the age count for 55 plus. And we noted that the population 55 and above was separated in this presentation because of the HUD definition for older persons. But there was a follow-up question, if you could answer regarding that demographic. It asks, Patty asks, is my understanding the older adults are the fastest growing part of our homeless population, correct?
That's also kind of a difficult question to answer because it depends on what source you use. So based on the PIT population, I don't think it necessarily comes out with our own PIT data. But when we do look at our HMIS data, which is what we try to collect on a more regular basis, in fact, what I kind of point to as our strongest way of predicting homelessness in our community is looking at the data that our providers submit on a regular basis. We might see something a little bit different. Off the top of my head, I'd have to double check to know exactly what that shows. But I do want to just mention that the exact thing that you learn might be different depending on whether or not you're looking at PIT data versus HMIS data.
Thank you, Trent. Another question asks, can you give more information about the count on the American River Parkway? How was it done and what were the results? So if you have a moment.
I can answer most of it. And so for the American River Parkway, we had partnered with specialized outreach teams the day after the formal counting process of the count in the morning to go out into the American River Parkway in an area that was predefined and pre-selected to conduct that count. And so that was included as part of the count. As far as the results, it's a little complicated, mostly just because all of those individuals would fall into the other jurisdictions. And so the count of those who were living within the American River Parkway would be found in the geography counts that I had provided earlier. And the other thing that's probably worth mentioning is that in about 2 months leading up to the count, there's a pretty significant portion of the American River Parkway, or the northern end of the American River Parkway towards Folsom, that ended up needing to be relocated due to very severe weather warnings and other things that were happening within that area. And so my assumption is that a lot of those people likely would have ended up in the Folsom count as well. And if you look at the data, there was actual increase for those who are experiencing homelessness in Folsom in 2024 relative to 2022. So part of that could have been from displacement through the pretty severe weather that was happening in the couple of months leading up to the pit.
You, Trent. I think that may be in line with what we just got in as another comment from Paul. As a volunteer for this past pit count, I want to note that in my personal experience, I think the count was low due to the weather at the time of day, and give us some more detail. So again, point in time count. And along with that note, as far as additional questions, there was another question for the volunteer attendance, and I'm not sure, Rachel, if you would like to take this, or Trent, you would like to speak to this, on how it varied from 2022. And they ask, is it possible that the lower results is a result of less participation in the pit count?
So I actually have a comment to Paul's comment in the chat to say that it's hard when you compare 2022 to 2024 because in a lot of ways, 2022 is a bit of an asterisk. So it was kind of in the heart of COVID and the conditions on the ground as far as social distancing, shelter in place policies. There were so many things that were different in 2022 relative to 2024. But the count in general is mandated by HUD to occur within the last 10 days of January, every time that it's done. And so that's a requirement by HUD. The only exception to that for Sacramento that I'm aware of was in 2022. And that was actually because the count was originally planned for January, but due to a surge, the Omicron surge, the Omicron variant surge in the pandemic, the entire count was delayed a month. That was relatively last minute, if I remember correctly. So having the count in February versus January, later in the day versus early in the day. That's one of the things I guess I want to get back to from the beginning of the presentation is just to emphasize that it's always going to be a point in time count. And what you count in February in 2022, in the middle of the pandemic, might be a little different than what you count in January in 2019, in 2017, and in 2024, because of just how many conditions there are and how many variables there are with a single point in time. And then can you remind me, Sarah, the second question?
Yes. I'll pull that back up. It was in regards to the volunteer count and the attendance specifically, how it varied from the 2022 count and how that may have impacted the results.
Sure. So one of the things that you can find if you look at both reports in 2022 and in 2024 is that they mentioned the kind of the approximate count of volunteers that were able to show up on the night of the pit. And in 2022, they had reported they said approximately 500 volunteers in 2022. And in 2024, it was approximately 600. But we had recruited close to 900 or just above 900. So we had significantly more people in 2024 than were present in 2022.
Thank you, Trent. We have two more questions from attendees. The first is, how are you taking into account the hidden homeless, such as those staying with friends in cars or even with family members? Also, credit is a major issue that negatively affects the Black community. Is there a plan to address this issue, such as eliminating credit as a qualifier? So I think those are two very separate issues. And so, Trent, would you like to speak to the hidden homeless and those people who are living in cars or with family members and how they're counted?
Sure. And Rachel, do you have a comment for the second part of that? Okay. So just with the first part,
Sure do.
as always, the pit for a very, very large geography is a sample. And it's a sample with statistical rigor that is a process and procedure that is compliant with HUD. In fact, it is the exact process that we used in 2022 and before. There's always going to be differences in exactly how that's implemented, whether you use census tracts to divide the way that you canvass the area, or if you kind of pre-select certain zones. And so there's always going to be subtle differences there in operations. But the general procedure of geographical sampling and enumeration is consistent across the counts. And the goal with some of that procedure is to try to consider people that are not present during the count, that are not present. I mean, that because we don't have enough volunteers to go into exactly every single square mile within Sacramento County. So we do try to apply that statistical rigor to account for people that are unseen and unaccounted for. I will say that HUD's definition of literal homelessness does not technically include those who are, quote, doubled up or couch surfing. And so there's always going to be differences in counts between what HUD mandates to collect versus what other entities or other departments are requiring.
And I'll just add that there are specific instances within the work that we do at Sacramento Steps Forward that attempts to bridge that gap. For the school districts who count children experiencing homelessness quite differently than we do based on the HUD definition. And so we are making efforts to bridge the gap between those who are quite literally counted and those who may be missed, especially like individuals or families who are doubling up. So while we're not quite completely there, it is something that we're working on internally. And then the second part of the question was credit as a major issue that negatively affects the Black community, and whether or not there's a plan to address that issue, such as eliminating credit as a qualifier. And we are led by our racial equity committee in making every attempt within the homeless response system as a whole to make system level changes to the extent that we have control within the COC. Many of those efforts, which you can find in our racial equity action plan, which is listed on our website, does attempt to make some of those system level changes. But we also know that some of these systemic issues and historical exclusions are areas that we need to do a significant amount of work. And we are committed to making sure that if there is an opportunity for us to control some of these issues, that we certainly can do that. And in most cases within the continuum of care, not in most cases, in all cases, within the continuum of care, credit is not a qualifier as a way to get connected to housing. So if shelter is, the way for the individual to find emergency housing or beyond, those are not something that we predicate somebody's ability to find housing or shelter on. The other, let's see. The other question that I see here is, other than asking individuals if they had to relocate, was there anything done to, account for or work around sweeps on the front end or on the back? And I'll just say, as another body of work that our continuum of care is responsible for, we do have a point in time committee, and our led a wonderful education effort to make sure that we were spreading information to partner agencies around the importance of the point in time count, what best practices were to make sure that folks weren't being relocated during that time. And so there was a significant effort in education on the front end. And we continue to partner and continue to work together on the other side as well. And I think in our last, excuse me, continuum of care meeting, the chair of our point in time count committee said it best, that we know that we all have our individual charters within our partnership. And, our best effort is really going out there and making sure that we're supporting one another in the best way that we can. And we continue to foster those partnerships moving forward.
Thank you, Rachel. Then we have one additional question, which is, while the homeless count dropped since 2022, looks like 2022 was a bit of an outlier and homelessness is still consistently on the rise. Is that accurate? And it knows that it's based on a graphic from Cap Radio.
I think it's a fair interpretation. And so if you look at all of the pit counts together, you do see a very steady incline or increase across the years. The one exception is a very, very sharp incline in 2022. Whether you keep that in or remove it, generally across time, there is an increase. But if you were to remove 2022, it's in the middle of COVID, the year of the asterisk, we still see that increase. And that was one of the things that I mentioned towards the beginning of the presentation is that when you compare 2024 to 2022, there's technically a 29% decrease. But if you compare 2019, which is the last pit count before the pandemic, to 2024, there's a 19% increase. So even though there was technically a decrease through the pit count between the last 2 years, we still see an increase over time.
Thank you, Trent. And I think that's all the questions. So unless we receive any more, um, Rachel, Sarah, Trent, feel free to share any last words.
I could take us away. Hi, everyone. I'm Sarah. I'm the volunteer coordinator. You all hopefully maybe know who I am or maybe across my path for the pit point in time count this past January. I just wanted to drop a couple of resources in our chat right now. First is if you want to access our website and see some more information or photos or that video we were playing in the beginning of this meeting on the point in time count. We have some really great photos that were taken and a video that was put together. And then you can also see the link to the final full report for the point in time count. In addition, there's about a one-page infographic for the point in time count as well. If you're not as much of a reader and more of a visual person, this is way easier to consume than maybe going through the entire report. So I'm going to drop that here in the chat. In addition, if you are interested in getting more involved beyond the point in time count, SSF does oversee the continuum of care. And so we are made up of a bunch of committees that are all volunteer based. So if you're interested in sitting in or maybe even getting involved, please feel free to check out our COC committees. We have several committees that help advise on homeless services in Sacramento. So this is a really great way to become more systemically involved and learn more about the hard hitting work that we're doing to really resolve and address homelessness in Sacramento. And lastly, we do not have a date or a year for the next point in time count. But if you want to stay tuned for when that does happen and want to get involved for the next one, I'm going to be including our website where you can sign up, as well as our point in time count email if you have any additional questions that you might have for us. So I'm going to enter that in here now, and we can end our meeting here. It doesn't seem like there's any more questions that need to be asked. And I just want to say thank you to everyone who did participate in the point in time count. This entire effort is made up of volunteers and staff and community members and officials and everything. But when it comes down to getting our feet dirty, it's our volunteers that are doing that. And so we really appreciate you coming out and assisting us with collecting all this data and being a part of this bigger effort to change our community for the better. So thank you.